Hello, everyone. This is Dr. Porter with East Valley Naturopathic Doctors. Welcome to our first of a webinar series. Today we're talking about weight loss goals and detoxification, how to apply them at the same time for health, energy, and weight loss. This is our first webinar, so this is a first experience. We hope it goes off without any glitches. But any comments or any concerns, please let us know. We have as a speaker today, Dr. Laura Baromente, and many of you may already see her as a patient, but she is a wonderful doctor, so we're glad to hear what she's going to have to say about these things and discuss these topics. We have... hopefully on your screen, and what you see is an area in which you can have a chat. I'm going to just say hello here. And so if you can see that, if you have any questions or concerns, and again, as we go through the presentation today, we would like to have any questions answered. I'll save those till the end, Dr. Laura.
Yep.
And we can have you try your best to answer all the questions you create by your presentation. And at that point, I'll moderate those, and we'll go from there. I'm going to send that out, and hopefully everybody's seen that. I'm seeing a couple of people here who have responded. Thank you for letting us know you're there, and at least we know that these chat things work. So, there we go. A lot of people. Oh, thank you.
Good.
I want to introduce Laura. Dr. Laura is a graduate of Southwest College in Naturopathic Medicine in 2014. She completed a 2-year residency with the medical center there, and then joined our practice. And we've been grateful to have her here since then. She specializes in many things and has a diverse talents and abilities. She works in pediatrics, a lot of digestive issues, including SIBO and Candida. We'll talk about some of that today. Of course, metabolic issues such as diabetes and heart disease, and of course, women's health and hormones, and of course, in other areas, including mood. As many naturopaths do, she has an interest in fatigue, and as every doctor in our office is trained also in environmental medicine. And so we're able to talk about some of these really difficult topics that seem to be pressing upon us even more so today than they were even 20 years ago. So we're glad to hear from Dr. Laura. I'll let you take it over at this point.
Sounds good. Thank you for that intro, Dr. Porter. Nice to have you all listening here this afternoon. Today, we're going to talk about how to meet your weight loss goals and detoxify at the same time. They're often connected in ways we don't realize. Now, some concepts I'll talk about today may not be new to you, but they could be good reminders of things that maybe we've forgotten to do recently. And hopefully you'll learn some tidbits of things that maybe you didn't know prior. So, the Quarantine 15, fact or fiction? Well, the American Psychological Association actually did a survey last year after quarantine, and they gathered that 42% of U.S. adults gained an average of 29 pounds during that COVID-19 quarantine. So if this has happened, or if you've gained some weight in the last year, you're not alone in that. And so, there's many factors that have been involved in this weight gain. And, I think our habits have changed drastically with quarantine time and COVID. But the main factors they found in this survey was that a decrease in physical activity was a big factor. Obviously the gyms were closing, people were working from home where maybe they weren't before, and maybe if they were out at an office, you'd be walking a little bit more or getting up out of your chair a little bit more. There was also, increased snacking and overeating. If we're at home working, it's a lot easier to go over to the pantry on your work break and get a snack versus if we're at an office and we don't have, immediate access to our food. I think another important thing to think about is the psychological impacts of the quarantine and COVID and, the stress and anxiety, and, there's more rates of depression, and all these things definitely in our mental health, and stress eating is a big issue for a lot of people. So, a lot of factors have been involved through these COVID times. So these first things I'm going to talk about may not be new concepts, but they're definitely our foundations of how to maintain a healthy weight. So number one, our dietary factors. So what is the quality of the food that we're eating? Are we searching for convenience foods and eating fast food, or prepackaged processed foods with a lot of sugar? Or are we eating foods in their whole, natural occurring state? Are we getting fruits and vegetables, shopping in the produce aisle and getting, meats that we have to prepare ourselves? So, sometimes actually simplifying and doing your, side of vegetables and your protein, keeping it simple instead of already getting that, pre-made, pre-processed that may have, preservatives or additives to help keep it shelf stable. Also, if foods are organic, the toxin content will be less, and we'll talk about that a little bit further on here. Quantity of the food. So, I don't always want people to hyper focus on the calories, but, if we're eating too much or snacking frequently through the day and we're taking in more than we're exerting as far as energy goes, then it's going to make it harder for us to lose weight. I think, being mindful of how much we're eating. If we're sitting in front of the TV and you have a bag of snacks in front of you, you don't always realize how much you're eating. We have to kind of pay attention to the signals our body is giving us if we feel full or not. And giving yourself a rest, between your meals. So that leads us kind of into the timing of eating. And so when it comes to timing of eating, I want to talk about a concept called intermittent fasting that has become a little bit more popular lately. And so when it comes to our metabolism naturally wants to shift between our more of a fasting state, and then it shifts when we start eating food. And so our ancestors, when food was not readily available, their metabolism would have to shift into a fasting state. So then it would start using its fat stores for energy. When food was plentiful, then the metabolism would shift again and starting to use sugars and the nutrients in those foods a little more available than the stores of energy in the fat tissue that we've built up. So, the body naturally wants to have this metabolic switching happening. And so if we're always in this state of feast, snacking frequently, eating frequent meals, eating late into the night, then our body doesn't have that time to switch into the other state of our metabolism. So we can achieve this. And when we achieve this and switching into the fat stores, we're able to reduce our weight easier that way. And so you can do this by eating in a specific window each day, like a 6 to 8 hour window. So basically, say your last meal of the day ends at 6 p.m. Then you don't eat anything else after that evening, go to bed, sleep, wait until maybe 10 a.m. or noon the next day to eat your next meal. And this will give your body time to switch. It usually takes a few hours at least to start using up those sugar stores and then switching into using the fat stores for energy. Another approach out there is the 5-2 approach. And this is basically 2 days of the week. Maybe it's a Monday and a Thursday, for example. You just eat one meal a day. Now, in particular, I think the eating, every day, having a 6 to 8 hour window, doing that more consistently, I think people will get better results for weight loss from a weight loss perspective, that is. I also like to say that when we do this intermittent fasting, it gives our organs and our digestive system a time to actually rest and repair. That time is really important for those organs. The next one is obviously physical activity. Something is better than nothing. It's easy to make excuses, but we have to keep our body moving. It's so important. Even if it's just going up and going for a walk. We can look up workout videos on our computers now. I'm sure, like the lady here in this picture, you can do exercise in your living room. And if you have a dog, they probably will enjoy joining you for that. But, there's various different exercise videos. You can find one that kind of fits your tolerance level and modify it based on what you're capable of starting at. But I would say, you got to get at least a minimum of 30 minutes of some sort of physical activity every day. I wanted to highlight high intensity interval training because this has been studied the most when it comes to weight loss. And high intensity interval training definitely has more evidence of burning in our fat stores more effectively. And so this involves typically, say, for example, someone's running on a treadmill. So they may do a 30-second, upwards of 4 minute stint where they're sprinting, they're going at their highest intensity that they can go at. And then you bring it back down, for another 30 seconds to 4 minutes, you go at a lower intensity level. Maybe if you're on a treadmill, you're reducing to a walking pace where now you can breathe a little bit better. You could talk, to someone next to you if you needed to, taking down that intensity more. But then after you go through a few more minutes at a lower intensity, then you go back up to the high intensity, push it and sprint, go at that pace. And we want to alternate between these anywhere from, 4 to 6 rounds of that. And you can sometimes achieve the results of a longer type of exercise. Say you're running at a consistent speed for 45 minutes to an hour where we may not get those results. But at a shorter time frame, doing the high intensity interval training, you can achieve results in a shorter time period. So I wanted to talk more about insulin resistance because high intensity interval training does help with insulin sensitivity. And this is an underlying issue when people are really struggling to lose weight. So what is this concept? You may have heard it, in passing and not really fully understanding what it is. So I'll kind of walk you through the mechanism of insulin resistance. So when we eat more carbohydrate-rich meals, and carbohydrates, if you're not familiar with this, are basically long chains of sugar molecules. And when we eat that carbohydrate, our digestive system is going to break down that carbohydrate into sugar, or glucose as we call it. And then we absorb that glucose into our bloodstream. And so then our pancreas gets the signal that, oh my gosh, okay, I've got this high amount of glucose in my blood. I need to secrete insulin. And insulin is the hormone that's like the key for that glucose or sugar to get into our cells where we can use that sugar for energy. Now, if we start eating more and more carbohydrates or sugars, we start pumping out so much insulin that the cells are basically going to start rejecting that insulin. And that's what's called insulin resistance. So then it gets harder for that glucose to get into the cell. So your cells are saying, I'm starving, I need glucose. And then your body, will start getting hungry and will feel those cravings. And that will actually drive our body to start storing fat because it thinks it's starving. So that's where we start getting abdominal weight gain, sometimes fatty livers involved with insulin resistance, but we start getting more fat production because of this high insulin level, triggering this starvation mode in our cells. Insulin will stimulate cholesterol production in our liver. And so we have that direct connection. And sometimes people don't realize this when we eat high carbs, it doesn't have to be a fat-rich meal, but the carbohydrates in and of themselves will drive this fat deposition in the body. And then it gets in this vicious cycle where, if your cells are starving for glucose, you're going to start craving sugars and carbs again because it's trying to get that fuel and that resource for it. So the next foundation of healthy weight is certainly quality sleep. So there's been a lot of studies regarding sleep that getting less than 6 hours of sleep is associated with obesity. When we have a lack of sleep, this increases leptin and ghrelin, which are hormones that cause our hunger feelings. And so that will increase if we're not getting enough sleep. And then people will typically overeat during the day. Another common issue that people have regarding sleep is sleep apnea, and this can go undiagnosed for a lot of people. And when we have sleep apnea, basically multiple times through the night, your breathing will stop, and then the body's not getting the oxygen that it needs, and that is a stress on the system, and that will also feed into insulin resistance. It affects how glucose and sugars are starting to get utilized in our body. So if you have sleep issues and you've been struggling with obesity, getting a sleep study is really helpful, because if you do have sleep apnea, getting a CPAP machine or something to help open your airways will help your metabolism in that way. Because, if we're not getting quality sleep at night, then typically we're tired during the day. And if we're tired during the day, then we're going to be less likely to have physical activity. We may not have the energy to go out and exercise. So it becomes this vicious cycle that we get stuck in. So what if you have all these foundational things dialed in and your weight is still stuck? So we want to think toxicity in these cases. So obesogens are chemicals that are shown in many studies to reduce our metabolism or interfere with our metabolic state. So chemicals such as heavy metals, some solvents, pesticides, BPA, which is in plastics, organophosphates, phthalates, PCBs, many of these chemicals we can be exposed to from food that we're eating, chemicals used in our homes, the quality of our water, say you're using a well water or not getting your city water filtered well enough. We can be getting these in body care products, typically more of the phthalates and parabens, and those can have hormone disrupting chemicals. So we want to help assist our body's ability to remove these chemicals from the body. So the next slide has a good depiction of what happens when we are toxic. So what happens is a lot of these toxins are stored in our fat tissue, and fat tissue is actually made to help protect the body from the toxins that can cause damage to our cells. So when we start dieting without detoxifying, the toxins just get dense in the less amount of fat that you have. And then when that density gets so intense, the body's going to try to protect itself and create more fat again, and we gain the weight again. And so that's where some people, they diet, and then, as soon as they get off the diet, then they gain weight again. So if we're able to actually remove those toxins, we can help sustain a better metabolism and also help maintain that healthy weight. So how do we detoxify? There's many different ways we have to approach this. And number one is always we have to reduce our exposure. And so food-wise, we want to eat organic food if we can, low sugar food, low processed foods. Environmental Working Group is an organization that comes out with guidelines, and it will explain, the top 12 produce foods that are sprayed with pesticides. So if it's hard for you to buy organic, you can know, okay, these foods are, healthier and they're not sprayed as frequently, or, finding some sort of, natural remover for the pesticides that you can wash your vegetables in before you eat them. And if you didn't know already, I'm just going to pause here. We do have a handout section. So I do have the slides here. So if you're worried about getting the links, they are in the handouts there on the side. We also want to make sure our water is purified. As I mentioned before, sometimes well water has heavy metals like arsenic or lead. City water often has chlorine and other chemicals that haven't been properly filtered out. So having some sort of water purification system is really helpful. If you have an RO system, sometimes this also pulls our minerals out of our water, and we need minerals for our cells and proper hydration. So making sure we have some source of that, and we can add minerals back into our water if we need to. Clean body care products are also really important. Environmental Working Group also has a resource. They have a Skin Deep page. So if you're not sure if you have a good body care product, like your shampoos or soaps, you can go to their Skin Deep website, and they have good ways of resourcing, which products could be the safest for you. They even have one annually on sunscreens. That's a really good resource. Cleaning products. So people have definitely been disinfecting a lot more in the last year, and there can be more harsh chemicals out there. And yes, you want to make sure that what you're using is properly disinfecting the area. But there can be more clean, natural products that can still have good disinfecting. And EWG, or Environmental Working Group, also has a cleaners products listing. Also, toxins that we could take in, alcohol, making sure we're not using nicotine or smoking or overdoing caffeine. All these chemicals our body has to filter through. Your liver is the first stopping place for a lot of these toxins. And if we're overloading it, it sometimes doesn't know where to start. And that's where we start having issues. Step number 2 to aid our detoxification is supporting our organs that eliminate the toxins. So I already mentioned the liver being number 1. So when we have the toxins in our fat tissue, they are fat soluble. So we have to be able to convert them into molecules that are water soluble so our body can eliminate those properly. And so you'll see that picture there of the liver. Phase 1 and phase 2 are processes in the liver that help transport these molecules from fat into water soluble. And we need certain vitamins and nutrients for this to happen. And so when we talk about some products and nutrients that can do this, that's what our cleansing programs assist with, all the nutrients that aid in phase 1 and phase 2 of detoxification in the liver. And so once we convert them into water soluble toxins, then we eliminate them either through our digestive tract. So first it gets dumped into our gallbladder, and then our gallbladder flushes that into our intestines, where then we eliminate it in our poop. And so if you're not pooping, that can be a problem, especially people who suffer from constipation. Then they're definitely not eliminating toxins from their system as efficiently as they should. And if we're starting to get, some bacterial overgrowth in the gut, or yeast overgrowth, or, we've got inflammation in the gut that then leads to food sensitivities. If our gut's not in a healthy state, we're not going to eliminate these toxins efficiently. So we do have to work at that level of things if that's not functioning how it should. And the kidneys, the other one, our urine is another efficient way of excreting these toxins. A lot of our testing that we do for toxins, whether it be heavy metals or even mold toxins, those are actually urine tests, because we do dump quite a bit into our urine, and that can tell us how much has actively been circulating and how much we may be potentially exposed to. The skin would be the other one. It's not on this picture, but our skin and being able to sweat out toxins is also really important. People that tend to have a lot of acne, or, their skin just is not healthy, those are some signs sometimes that we're not eliminating toxins through these other avenues, like our digestive tract or our urine. And we're starting to try to excrete more toxins through the skin, but it's just not working effectively. So sauna, we're going to talk about in a little bit, but that's a really effective way to sweat out those toxins through our skin. So I like to talk about our guided cleanse programs. And if you're curious about this, you can ask your doctor if a cleanse would be a good option for you. But I always like this as a good jump off point, because these cleanse programs, they have all the nutrients that our liver needs and our digestive tract that helps aid in that detoxification process. So, again, just dieting alone and working on the food without giving the body those nutrients that it's going to aid in eliminating toxins, we don't always get the same results. And not all cleanses are the same. So, if you try a cleanse and it doesn't work well for you, there are other ones. We have a couple options here at the office. Our Core Restore is a 7-day detox program, and we have another one that's a 10-day program. And I'll talk on the next slide what's involved with those. But sometimes the 7 days, if you haven't done a cleanse, it seems more feasible, and then we can go into a longer time if we need to. to help maintain that. I also developed a 10-day cleanse program that is in the handout section for you. And my cleanse focuses a lot on, again, the detoxification nutrients, but it also will eliminate a lot of common food sensitivities that people have. And like I said, try different cleanses. Some may work better than others. Some have different food recommendations. And so sometimes, people may enjoy the food better in one cleanse than another. Each of these have a different protein drink with it that has, the nutrients that aid in detoxification. And, you may like the taste of one better in one program versus another. But I always encourage doing a cleanse seasonally. They're safe to do, 1 to 4 times a year. Sometimes people maintain eating, the foods that are often recommended in these cleanses long-term to help maintain their weight going forward. I always encourage it after major holidays because we know, the holidays are the times when our diet definitely gets off track. We could definitely be eating more sweets and more quantities of foods and things. So that's always a good time to re-jump your system with a cleanse. So what do those cleanses typically involve? I've already kind of alluded to this, but there's a medical food with those. And if you do my 10-day cleanse, we'd have to make sure, we get you the protein drink with that, because my cleanse handouts, got the guide there. The 7-day and the 10-day one that I mentioned, I'll show you a picture of those two on the next slide. Those have the protein drink included. They also have supplements included that aid in detoxification, and also, the meal guides and recipes and everything that you need. So if you do my cleanse, then you still have to purchase like a protein drink that aids in the detoxification with that. And a lot of times these cleanses do involve the fasting, like we talked about the intermittent fasting. So this gets incorporated into the cleanse so that we're achieving some of that metabolic switching time. Most of the cleanses avoid the common food allergens. Typically that is like wheat and dairy, wheat or gluten, so to speak. And yeast is a common sensitivity for a lot of people. And there can be others, and you could still have food sensitivities to somewhat healthy foods. I've had some patients who have done my cleanses before, and, maybe they didn't get a lot of weight loss, but we ended up doing food sensitivity testing, and they had sensitivities to foods that we think are typically healthy, like nuts and certain vegetables. And when they finally took those inflammatory foods out of their diet that their body wasn't reacting well to, then they lost weight, without making other drastic changes outside of that. And like I said, these programs do include recipes and meal planning guides to help you along the way. So the two here that we have options for at the office is the Core Restore. That's the 7-day detox kit. This one's by Orthomolecular. And then the other one is the 10-day Clear Change Metabolic Detox by Metagenics. They are both a rice protein base in their protein powder, and they are low in sugar, because there are some protein drinks out there that definitely have too much sugar in it, and there may not be, focused towards detoxification either. So we know in these products, they've got all the vitamins and nutrients to help with that process. I also want to highlight sauna, because sauna has been well studied for assisting with weight loss, and sweating is a really effective way to rid our body of the toxins that it's storing. Sauna helps induce lipolysis, which is, the metabolism of those fat cells to help start releasing the toxins so that we can excrete it through the sweat. Heavy metals can be excreted this way, pesticides and solvents. And as far as the metabolism goes, the Journal of American Medical Association did a study, and it showed that you can burn up to 600 calories in a 30-minute session in an infrared sauna. And this is a typical time frame to spend in the infrared sauna is about 30 minutes. It works by heating your core body temperature, which then increases your blood flow and your heart rate, a lot like exercise would. And infrared heat does penetrate our tissues deeper. So and that starts heating our core more effectively than, say, you're just exercising and sweating. So being able to heat our core body temperature more helps the efficacy of that. And sometimes people, when they get in the infrared sauna, it might take, a few minutes till you really get to that point of sweating, because it does take time for that heat to start penetrating into the body, into the cells, to start inducing that. We typically recommend, if someone is trying to lose weight or working on a detoxification program, to do infrared sauna. Again, 30 minutes usually per session, 3 times a week. That would be ideally, if you could at least do twice a week if you're actively trying to detoxify, up to 4 to 6 weeks in a row. And that would be the best way to know, okay, what kind of results do we get if we're adding this into our treatment plan? We do have, just so you know, in our treatment center, in our EVND treatment center, we do have infrared sauna therapy available. Our saunas are clean, no weird chemicals, no glues, so you can know you're going into a clean environment when you do infrared sauna. It's also really important to rinse off or wipe down your skin right away after you've been in the sauna, because you don't want to potentially reabsorb any of those toxins that you've just sweat out of your system. Other additional detoxification support that we have here at the office are nutrient or vitamin injections. So we have different variations of our slim shots, upwards of our super detox shot, and all of these include vitamin B12 and methionine inositolcholine, which is a nutrient that aids in fat metabolism in our liver. And the B12 often will also additionally help our metabolism, and also help sometimes if we're feeling fatigued or our energy is not as good as it could be. The super slim shot adds in B complex, which adds in some of those additional B vitamins that, the liver does need certain B vitamins to help in that phase 1 and phase 2 of detoxification. And then our super detox shot adds in additionally glutathione, which is a really important antioxidant for the system and the liver to aid in detoxification as well. And a lot of times, the cleanse programs include nutrients that help our body produce more glutathione. Some also include glutathione supplementation, and that's something you can always supplement additionally. But that's a really, really important nutrient and antioxidant to aid in detoxification. Typically, we recommend, if you're trying to lose weight and working on a program, to do an injection once a week for maybe 4 to 6 weeks in a row to assess if this is helpful for you. It may not be a magic fat melter, so to speak, but you may lose maybe an extra ½ pound a week, getting those additional nutrients in your system. So what do you do if you feel like you've tried everything, you did all this and nothing's working? That's when you probably want to have your doctor check into some other things that may be underlying why it's hard for you to lose that weight. So we've talked about insulin resistance. And typically with insulin resistance, the typical body type with that, we tend to get a lot of our abdominal weight around, or a lot of weight around our abdomen and a lot of fat deposition in the abdomen. And this can be a precursor to prediabetes or type 2 diabetes, where our blood sugars are starting to get not well regulated. And we can do blood work, if you haven't had yearly blood work, checking your blood sugars. But, I've had patients who they can have a normal blood sugar, they can have a normal hemoglobin A1C, which is kind of your average blood sugar over the last 3 months. But you can still have a high insulin level, and we check an insulin level in the fasting state. And if that's high, we know that the metabolism is suffering from that. There is a condition called PCOS, which some women have, called polycystic ovarian syndrome. And a lot of these patients, they struggle with their weight. Overweight and obesity is really common, but underlying insulin resistance is the main issue. And so, a lot of times they have normal blood sugar, but their fasting insulin can be through the roof. And we have to do things to help bring down that insulin. And yes, we have to start with a low carbohydrate, low sugar diet, but we can also do nutrients or herbs like berberine, And if, natural things aren't doing the trick, sometimes medications are necessary in certain instances to help achieve that weight loss. Another hormonal issue to look into is thyroid issues or low thyroid function, which is called hypothyroidism. If we're not producing enough thyroid hormone, this does cause weight gain, causes fatigue, more, depression. We may notice our bowels are more sluggish or we're constipated. So there can be a lot of symptoms that can coincide with hypothyroidism and weight gain issues. Now, Hashimoto's is also really common. It's an autoimmune thyroid issue, and basically your immune system is attacking its own thyroid gland. And so this can cause more fluctuations in the thyroid hormones and eventually lead to hypothyroidism or low thyroid function. And if that's an underlying issue, there are specific dietary things we can do to help the immune system, and also treatment-wise, things to help reduce the autoimmunity as much as we can. The next thing, definitely menopause. As women start going into menopause and their estrogen starts declining, progesterone, testosterone, the balance between those hormones can definitely contribute to more insulin resistance and weight gain. In men, we tend to call this andropause, where testosterone starts to decline. And typically that also leads into more fatigue. And then, our activity levels start declining. In men can convert some of their testosterone to estrogen if they start having a lot of abdominal weight gain. In the fat tissue, especially in the abdomen, there's an enzyme called aromatase that will convert testosterone into estrogen. So if that's all converting over, that's going to make it worse as well. So there's treatments we can do if that's the case. Our stress hormones definitely play a role. If we're in a really anxious, stressed out time, we start secreting cortisol. It can spike at times during the day, or we could start bottoming out if we've been under chronic stress, and then we are starting to be fatigued. We may notice that we start craving sugars or sweets because, or even salty foods, as our stress glands are kind of running more than they should be. People start feeling like they, just need sugar to keep their energy going, or they start relying on caffeine, which then, bogs down our liver if we start ingesting more caffeine. Food sensitivities, I kind of already mentioned that part, but that can often be an underlying issue if we're not losing weight. The inflammation from reacting to foods that your body is just not assimilating well can cause a more inflammatory type weight gain. And then the last one I have here, gut microbalance. This has to do with, how healthy are the balance of the organisms in our gut? Do we have bacterial overgrowth? Do we have fungal overgrowth? Sometimes parasitic infections. And so if we have symptoms that are pointing towards our digestion not, working how it should, then we can do treatments to help balance out those microbes. And typically too, if we have overgrowth of organisms like yeast in particular, people start craving more sweets because these organisms feed off the sweets and the sugars. And so that drives the cycle of, craving the carbs. Well, that kind of wraps up the presentation for today. Thank you for listening. If you are an established patient here at EVND and you'd like to try any of the cleanses or therapies that I mentioned here, please contact the office. We do have some supplies of things, but we want to make sure that we have it available for you. If you're not currently a patient and you're interested in some of these treatments, please contact the office to schedule a consult with one of the doctors here. And there's our contact information there for you. So I think at this time, we'll open it up to any questions.
Hey, great, Laura. I love that presentation. You talked about some of my favorite things: intermittent fasting, detox, sauna.
Yeah.
These are things I do on a regular basis. So, and I have, just as a reminder, everybody in the chat, you can offer some questions. There was a question that did come up, and hopefully, I know somebody's been patient waiting for that answer, but they did ask, what water filter do you recommend? I had a thought on it, but yeah, what do you think?
Well, there are the standard kind of reverse osmosis systems, but those typically pull the minerals out. So like at my home, I do have a standard reverse osmosis, but I add trace mineral drops back into my water when I drink it. There are Berkey water filters out there. Berkey is a good brand. That one you have to it's kind of a stand. So it has a dispenser with it that you fill it with. There are also whole house water filters. The Pelican whole house water filter will help pull chlorine, so that, when you're showering or bathing, you're not getting some of those chemicals from, topical use other than just your drinking water.
Yeah, thank you. I've had patients, respond even historically with different reactions. And when they put a filter on their shower even, that they got rid of skin symptoms, itching, dryness. And so even a charcoal filter, which is available through a Home Depot or Lowe's, can be helpful in sensitivities. I have another question. Does drinking coffee break a fasting window? Good question.
That is a good question. Typically, as long as it's black coffee, that is typically allowed, and that does not break the fast. As long as it's a no-calorie beverage like an herbal tea, or black coffee, then that works.
Yeah, I've also used green tea, and we'll add even MCT oil or coconut oil to that. I did that this morning for my breakfast.
Nice.
Oh, another question. Do you recommend near or far infrared sauna?
I believe, isn't it the far infrared that we have?
It is.
Yeah, that's the common one.
Yeah, maybe I can explain that. Yeah. I mean, there are near and infrared sauna. There is benefits for both. Far infrared has much more studies on it in comparison, and it has, I think, better penetration into the skin. So it penetrates, an inch or two for a great detox.
Right.
So, but again, both are good, but infrared, more studies, I believe.
Yeah.
Oh, is spring water spring water in quotations, drinking water okay, like Arrowhead, for example, or is it not purified?
Yep, those are purified. The one thing you want to consider is, is it contained in plastic bottles? Because if, it's transported in the heat, sometimes some of those plastics of the bottle can leach into the water. So as we're trying to reduce toxins, that's something to consider. So the more you can drink out of, stainless steel or glass, or at least not drinking out of plastic that's been heated, too long.
Well, everybody's loving your answers, Laura. They keep asking questions. Can we talk about detox foot baths? We do have an article, on our website. It's kind of hard to find, I apologize, but on the front page of our website, we have a block or a section called Detoxification. And if you click on that box, it takes you to a section that describes sauna and foot baths and a number of different detox things that we do here. In there, it does list some of the research that's been done and some of the applications. I might refer to that. Any other thoughts on that?
We have the Ion Cleanse, a detox foot bath, and it has been well studied. The ionic charge helps to pull toxins out of the system, and so helps to pull heavy metals, pesticides, solvents. So that can additionally help, with our detoxification pathways as additional support.
Good. Yeah, I think it's good. And any other questions? Someone asked, how do we get the handouts? Now, maybe we didn't explain it. We apologize. But on that tab, the chat where we're in, if you look at the very top bar, it says polls and also says hands out. If you click on handouts, it should be under that section. Am I correct?
Yes.
Others have downloaded this, it looks like, and I think I'm correct in that regard.
Yeah, it looks like some people have downloaded it, so that's good.
Someone asked, noticed I don't sweat during a workout like I should. Should I try the sauna, or what can help me sweat?
Yes, I mean, sauna is a good way to start heating your body more from the core if you're not achieving that in an exercise regimen. And it may take you more sessions in the sauna to achieve a really good sweat, but definitely a good starting place. And, we always encourage people bring, water with some minerals into the sauna so that they're not going to dehydrate, after the fact. But it is a good starting place to help, assist your body in opening up and getting that sweat going.
Good. Yeah, we think just because we live in Arizona, we should be good at sweating, but
Yeah.
still requires some effort on our part sometimes to sweat here. Can glutathione be taken orally?
Yes, it can. We usually the liposomal glutathione has better absorption. So it doesn't have to be just in the injection, like I mentioned. There are supplements, there are liquid supplements, there are soft gel supplements. So whatever's easier, that can be an additional thing to add in. We also have IVs, we're able to do glutathione in an IV, and that can get a lot more of a dose into your bloodstream to help with that detoxification.
Another question we have, thank you, Laura, for that answer. Another question we have is, what role do probiotics play in weight loss?
Good question. I think there's a whole tip of the iceberg when it comes to probiotics, but there are a lot more studies coming out now that show, depending on the balance of the probiotics or normal good bacteria in our gut, there can be balances of those bacteria that can promote more obesity. So, we are starting to see some strains that can help more with weight loss. But however, if we have conditions like SIBO or small intestinal bacterial overgrowth, sometimes adding in more probiotics does not necessarily help in the beginning. But we're learning more and more on probiotics as far as what applications we can have. I know there was a rat study done that showed they did different bacteria. They affected the gut bacteria of two different rats that were eating the same and had the same, genetics, or I think they were all identical. And the difference in their bacteria in their digestive tracts, one group was obese and one was lean. So there's definitely a role that plays.
Well, and let me comment on that. Absolutely. Intermittent fasting, one of the best ways to regulate or really positively influence the microbiome. Again, when we eat constantly and we fill our body with too many carbs that affect insulin, and they also going to grow the bugs, the yeast, the candida, and the bacteria good. And sometimes we just have too much, like in the case of SIBO. Mm-hmm. And intermittent fasting, a great way to begin to change that microbiome. Oh, let's see. I'm sorry. Another question here. I take GI Detox daily for binding heavy metals. Are there any other binders that you recommend in addition?
That's a really good one. It's a pretty comprehensive one. There are some people that will use chlorella. I think that's been used a bit. Even sometimes soluble fibers like psyllium husk powder, as long as you don't have, bacterial overgrowth in your gut, sometimes the fiber aggravates those people. But even just having more soluble fiber is another way we can bind up toxins and eliminate them.
Yeah, listen, the quality of questions you're asking are questions I'd see a lot of doctors ask. Man, we got a really smart group here, Laura.
Yeah.
So another question, on a fast day, is there an advantage of drinking beef bone broth as one of the liquids we drink?
That's a good question. Do you know if there's, more calories in the beef bone broth? Because that may,
I can comment on it. Yeah, I
haven't used that.
Again, the beef broth has, of course, a lot of nutrients that can build up tissue, collagen, even protein. And so, again, it doesn't add, it wouldn't be considered like a dry fast. It would be,
right.
I said, like a liquid fast. But again, still a great idea. And use of beef bone broth or chicken bone broth or such a period of a few days or a week even, it can be very, very beneficial, and a lot of great studies on its benefits. So there are so many ways to fast, and intermittent fasting is just the beginning. We'll be discussing this more in the future because it's a very fascinating topic. A lot of research has come out, and there's so many variety of ways of how we can fast. And some of them, maybe we find that ones people like better for themselves individually than others, but this is certainly one of them that we're in agreement with. Let's see. What about bentonite clay for a binder? Is that safe?
Yes. So clay and bentonite clay is a very effective binder for removing toxins, and even toxins that are from our gut. And I think, doesn't GI Detox have the bentonite clay in there? I want to say that it
does.
Yes, so
it does have
GI
some.
Detox product does include that bentonite clay.
Well, I think we're slowing down on questions, but one last question we have is how often we look for, let me read it. How often can we look forward to more of your webinars? That was asked by a patient, not by me. Well, we actually are hoping to do this at least once a month. And it takes a lot of work and preparation to make put together good information. And so we already have at least one plan next month on brain injuries, or within a few weeks. And we're looking at others in the future on autism. I think we want to do one on fasting. I can see there's a lot of interest there. And if you have other interests, the things you'd like to see us talk about, please let us know. Again, there are so many things within natural medicine that are fun, great to talk about, that we'd love to. Someone wrote Alzheimer's. Absolutely. We have phenomenal, great research on this and written many things on this already. Someone wrote heavy metals. Love it. Great ideas.
Yeah, good ideas of what people want. Yeah.
Yeah, I mean, those are great topics, and we have a lot to say about every one of those. And they're so important because they're, so little's been distributed or talked about within just general medicine. And again, we know people are suffering with numerous problems in these regards. So yeah, look forward to meeting those needs.
Excellent.
All right. I think that's it. Thank you, Laura. Much appreciated. Yeah, loved it. And good questions. And again, this has been recorded. We're going to send it out again here soon in some format or another. And again, we appreciate everybody's participation and being present with us. And again, we hope to bring good information that helps and improves your health. Thank you again, here from East Valley Naturopathic Doctors. And we will talk to you soon. Have a good day.